I'm Jason Bellamy here in Nashville, Tennessee, where the 47th Mary McMillan Lecture just completed, and it was delivered by Carole Lewis. First of all, congratulations.
Oh, thank you. Thank you.
So you talked about a lot of things, and we won't be able to cover them all. But you really, one of the focuses behind the whole talk was about the older adult and how there will be many more of them, and the physical therapists need to be prepared to treat the older adult, and that we're not prepared. What are some of the reasons that we're not prepared currently?
I think a lot of people have not realized how many older adults are out there. I also think that maybe 10, 20 years ago we didn't realize that we could help arthritis, help people that have hip fractures. We didn't realize how effective physical therapy really is. So now that we know that it's cost saving, that it's incredibly effective, we really need to put our efforts to getting therapists out there working with this population.
So speaking of that, you mentioned that when you started out, for example, that there wasn't a lot of evidence, and now there's so much evidence. And so how do people combat that, and what do they need to do?
Well, they need to read. They need to go to good courses that give them that evidence, and they really need to stay on top of the subject. It amazes me that in the field of medicine, for example, they publish so much, and the physicians read a lot. I think our profession sometimes doesn't do that. We really have to stay current. There's just so much stuff going on that if you don't stay current, you're not going to stay on top of it. But again, going to sites that have current information, that'll help you practice as a better clinician. And it doesn't take that long. Get onto these sites, get the latest research, and just even read the abstracts. And if there's something you really like, read the whole article, and then learn how to stay on the top of your profession.
Yeah, you challenge physical therapists to be ravenous lifelong learners. On that note, you suggested like a pattern that you see patterns where potentially people do leave PT school with this wealth of knowledge, and then instead of expanding on it, having it decline.
Right.
So you mentioned a little bit already just some of those steps, but how does that happen, do you think?
Well, I think you learn so much in school that you get done and you go, all right, I'm done. I don't want to open another book for another 50 years. You can't do that. And again, I don't know if I was all that ready to learn more when I graduated. I took a couple years and I, sort of worked on my skills that I currently have. And then I started realizing, gosh, I could learn a little bit more about that and a little bit more about this. And just taking some time to up your skills, saying, I'm going to spend 20 minutes trying to look at the latest in rotator cuff tears. And I can tell you there's so much out there that you'll find something that really piques your interest.
You talked about challenging physical therapists to really, whether they're talking to prescribers, whether they're talking to the media, whether they're talking to the public, about identifying themselves as prescribers of exercise. And you said, we can't just say exercise, we have to really own that. So talk about the physical therapist's role in prescribing specific exercise.
That's my favorite. It kills me to see somebody that's going to a gym, for example, and they injure themselves. I really feel that our role is incredibly expansive. If someone has lumbar stenosis, for example, they should see a therapist who then will prescribe the program. And, at some point, yes, they can go to a gym, but the therapist has to be the one to manage that person that has that physical problem. Going to a gym with a lumbar stenosis, I can't tell you how many patients I see that do that, and then they can never exercise for the rest of their life. We can save so many people's quality of life by getting involved early and letting physicians, letting the media, every time you talk to somebody, say, yeah, you're going to the gym. Did you ever think of going to a physical therapist for that and getting them to help you get started at least? So we really need to own it. We need to manage that whole area. I do believe ancillary people are important, but I think when somebody has at least a medical problem, I think we could expand more than that. We have got to be the ones that are saying, this is us. Just like pharmacists manage drugs, we manage exercise. Physicians don't know about it. They say exercise. That could be more harmful than anything they say to their patients if they don't do the right exercise.
So you mentioned needing to be prepared for the silver tsunami, as you called it, all the older people that are coming and are going to need care. And you made several recommendations, among them that every PT and PTA program should have at least one course in geriatrics. They should have at least one geriatric specialist. But you also said waiting until they're older to start is not the thing, and that there are too many patients who say, I wish I'd known this earlier. So how does it start earlier? How does that happen?
Well, I'll just take one example, posture. You know, nobody pays any attention to posture. Trainers that I've worked with, that's just one piece they don't even look at. So, you know, if you see somebody who's 20 years old and they're humped over their desk like this, they need to be seeing a physical therapist to work on their thoracic mobilizations and exercise so that they don't end up unable to control their head when they're 70 years old. I mean, that's just one, you know, lack of core strength for people that eventually are going to have horrible back pain, or even hairdressers that are constantly with their arms in the air that end up with rotator cuffs. I mean, we should be talking to these people at age 30, not waiting till they get a complete tear of the rotator cuff at age 60. So, you know, go into places, go into hair salons and say, you know, I would like to do an in-service, you know, to talk to your stylist about the shoulder and how it works, and spread the word about what we do.
As you can tell, it's a stimulating lecture, it's an entertaining lecture. Congratulations again. And so for Carole Lewis, I'm Jason Bellamy. We'll be giving more updates from Next, and you can find those on the Next website. I'll catch you later.